Are watching the Doctalk show.
We are glad that you're with us tonight on the Doctalk show and that you're enjoying what you're talking about and you're actually learning from it. In fact, you've asked me a question that I want to put to David. Manzi had two aids, as you could see, whereas Angel had one, and both of them were happy. Where's the difference?
I mean, they're happy because they're using the right product. But jokes aside, so we call that bilateral and unilateral, like the word says. One is 2 years and one is 1 year. And like nature, I mean, I'm not a doctor, but I try to explain it in the best way. Nature gave us 2 years. That has a reason. So with 2 ears, we are able to localize sound, which means that if I hear somebody walking outside or behind the cameras in the studio, if I have one, so in that case, Angel might have trouble to localize. She would hear the steps, but she might have challenges to localize actually that the steps are coming from behind that part, right? While Munzi having two has a easier time to localize and actually tell this is where the steps are coming from. That's why we encourage patients and parents, especially of children, to try to go for a bilateral solution, meaning to implant to both ears as quick as possible.
Thank you. So it is natural to have 2 ears, and if you can have 2 implants, well and good. And I'm sure we have those options back here at home. So we have this big dream brought to our country that we can actually do implants. And David, Daniel, and Eddie, how have you worked together to make this happen?
No, I mean, again, after we were in touch with Professor Roland, I got to know Eddie. This is also a long story, I guess, doesn't fit the show, the whole show. But eventually we got together, and Eddie heading and have founded already at that time, Hear His Voice. We agreed and said, okay, yeah, that must be the first partner in our program. And then, of course, we needed a place where we can do these cochlear implantations. And it has to be a safe place, a clean place, a place where an implant can be implanted without or reducing the risk, making them as minimal as possible for infection. And this is how we got introduced to Dr. Daniel and TMR International Hospital. And now we are here, the three musketeers, trying to bring that hearing to Uganda. But I guess they can explain it more.
So, yes, Daniel, TMR, what makes us choose TMR to have the implant?
Well, I think TMR's position in Uganda, one of the key things, as David was saying, was to look for a safe place. In any medical intervention, safety should always come first. You want to minimize your complications, where infection, of course, usually during surgery, among the complications, infection comes as number one. So TMR provided that platform that the surgeons can perform the surgeries in a safe environment. But also, TMR had the capacity to invest into the instruments that are needed for the surgeries. So that's how David, Professor Roland, Dr. Chris, and Hear His Voice, we vetted ourselves and we found ourselves fit to work together, because we're working in a synergy together, but also we're independent, and we must make sure that our quality controls are right in place for us to have these surgeries performed safely and outcomes being very good. And since we started this program, we have had more than 7 implants, and we have not had any complications whatsoever. So it's something that we're very, very proud of, and it also makes us happy when we see that Hear His Voice follows through in rehabilitation, because as Eddie said, the surgeries are the smallest part. Rehabilitation is the biggest part.
Okay, so Eddie, we have the implant available, and you have the hospital to safely get it into the patient. How is this helping you? Is it great news for you? And is it helping you to achieve your dream?
Yes, I'll back off a little and talk about the devices when David talked about the bilateral and unilateral. You know, that is the beginning of the implant. But it also has different accessories, and these different accessories work to enhance the quality of sound that is inputting into the brain. Without that quality of sound, it will be difficult for you to output with auditory oral communication. That is the goal of the implant. So once the surgeons have put in the implant, you need to come and learn how to use these signals that are being fed into your brain in order to interpret them as language. Because after spending a lot of money into the implantation, you don't want just to not use it. So rehabilitation is critical, that you'll be able to learn how to interpret these signals and use that to be able to communicate using auditory language.
So, yes, thank you. So now that the implant is here, what do you have to tell your people?
With hearing loss, with deafness generally in Uganda, we didn't have so many options. The only option we had was, okay, you're done, your child doesn't hear, you don't hear, go sign in. With the implant being accessible locally in Uganda, that changes the story. We are able to see that these children who at one point were not able to talk and are on a journey to pursue their full potential. The world is becoming global village. The jobs are going to be competitive. We need to make sure that these children can compete favorably for these jobs. And language is one of the key things that helps one to excel in academics.
And if I may add, Dr. Joseph, it's very important, and you can tell this is not a one-man show. This is not Cochlear going into a country and trying to change alone everything. But we do not do this without having this kind of structure in place and making sure people get the necessary service and rehabilitation, because that's key. We can only produce the product. The miracle is done by people like Eddie, by the parents at home, and so on. So it's very important. And if a message to your audience, it's clear. So if you have a disabling hearing loss, don't hide, don't isolate yourself from social life, but try to solve it. Make sure you know what kind of hearing loss it is. Today there is a solution for everything, even for severe to profound deaf people.
And there's a great team that is there to support you, from the doctors, from the rehabilitation team, psychosocial workers, and everyone. TMR, we are glad that you're offering this service.
Thank you very much. Just something to add on. It's very important for us to understand that the cochlear implant is the end of the spectrum. As the parents were here, Justin and Gordon discussed in detail what could have caused the loss of hearing in their children. So it's very, very critical that we take this up and prevent hearing loss as much as possible. But we must start with the basics. And the basics are simple. One, when you're pregnant, make sure that you attend antenatal services. It's that simple. Make sure that you see your doctor and they screen you for some of the infection that can actually end up causing hearing loss. The second thing is make sure that the children get vaccinated, okay? Because some of these causes of hearing loss can actually be prevented by simply vaccinating. Then, if you notice that your child has a hearing problem, you seek medical attention as early as possible so that we're able to detect the cause and possibly prevent it. You'll find that maybe, as you said before, they may need just ear cleaning, and then you're good to go. You may find that they may actually need the hearing aids, and then they get them. And if the doctors do all the tests and they find that there is a profound hearing loss, then we know for sure that we can still get the cochlear implant done here in the country and rehabilitation done here in the country, safely and securely. Thank you.
So, worry not if you have hearing loss. The country is well equipped to handle you. Get assessed. Mothers, Fathers, let us prevent deafness. Attend antenatal care, immunize your children. Do not stigmatize those that may have challenges hearing, but bring them up and we can rehabilitate them. We can make their lives better. They can get to hear. Again, it is a Doctalk show that you have been watching. It's been a pleasure having you. See you next time.